As some of you may know, one of the contemporary branches of craniosacral therapy is called visionary craniosacral therapy, and it works with specific energetics of each cranial bone and what kinds of symptoms show up when they are faulted, or if they're imbalanced, or if a suture is stuck. And one thing I'm thinking about these days, as I'm working with people, here in my table is, the temporal bones are one of the primary places that we check to keep the cranial system happy. And a very common move that we do is we're listening for this. The temporal bone is it's kind of like this. It houses the ear, and it's half of the temporomandibular joint right here. The zygoma is right here, and it attaches here. But anyway, this is the temporal bone, and one of the common moves is to this is very gentle, and please don't do this if you're not a craniosacral therapist, if someone's listening, but within the rhythm, within the tide, within the capacity of that tentorium meninges, within the capacity of the range of motion, within the permission of the body, is the decompression of the temporals, and that means really slowly bringing it back. And it's not a large movement, so it wouldn't be something that you could see. It's just something that would be, you could palpate it if you have the palpation skills for it. And but here we are. We have these masks that are continually exerting pressure anterior, towards the face, which is a compression of the temporal bones into the sphenoid, the zygoma, the temporomandibular joint itself. And the originator of craniosacral therapy is a student of Andrew Still, who was the founder of osteopathy. He had a student, William Gardner Sutherland, and he wanted to prove that the cranial bones didn't move. He wanted to prove that they didn't move. He found out that they do. And one of the experiments he did was to make contraptions to force bones into certain positions, to impede the movement of bones on purpose, and then record what was happening to him personally. And out of this, there's a lot of work. And as I was saying about visionary craniosacral therapy, the visionary view of the temporal bone, some of it would be obvious, right? We have hearing. We have the mechanisms of balance. The body works very hard to keep the eyes level to the ground. To the body, keeping the eyes level to the horizon is a survival imperative. And partially, okay, I could get into the anatomy there, but bringing it back to the energetics of the temporal bone itself is we're listening. And in order to listen really well, you need stillness. And that's a wonderful paradox of a place that is managing the balance of the entire body. There's a proprioceptive capacity to understand our body in space. So there's a beautiful paradox about the temporal bones. Listening, stillness within movement. And from a chakra perspective, you could talk about, the energetics of the fifth chakra. The energetics of the fifth chakra would be speaking, communicating, expression, and all of that. So how do we, as energetic beings, how do we make choices around balancing what we express, what we withhold, what we share? How do we come to a place of stillness so that we can listen very deeply? That's one of the beautiful, I think, poetic paradoxes of the temporal bones. So if our temporal bones are being compressed forward, I'm just curious how craniosacral therapists, cranial osteopaths might see this time in history where our populations we're in voluntary compressions of our temporal bones, when usually we're trying to help people decompress right in here so that they can find balance. So maybe just a note, if you're experiencing more difficulties right now, you could just call it like the COVID knot of a little bit of compression in there. And I think we'll all work this out, but I think this is a temporal. It's a temporal distortion. Right.